Hi, my name is Marie Pochette and my partner is David Frampong. Our project is on children living with AIDS. Knowing that the face of HIV is increasingly young, for every person living with AIDS, a family and a community is affected.
With HIV/AIDS. All right, I do have a set of questions to go through. And so, Asia, what part of the world do you think is mostly affected with HIV?
Well, I think HIV has reached every corner of the globe, although some are more heavily affected than others. A vast majority of these people living with HIV are in parts of Africa.
Okay. All right. So what age group would you commonly see people affected with HIV?
Most new HIV infections would occur in adults the age of 25 or even over. More than 4 out of 10 new infections occur among women. Globally, between 2002 and 2013, there has been a reduction of infected children under the age of 15. Despite this, there are still more than 2.6 million children living with this disease.
Okay. So what are some causes of children contracting this virus?
Most HIV children are infected through childbirth, through the birth canal transferred by the mom, through breastfeeding. Another would be blood transfusion, also rare, but is still seen in developing countries that do not have the proper medical equipment to test blood. You would also see it through drug use. For an example, there was a study done in Europe of the children's share needles, and these children were at least 10 years of age. And you also see it through sexual abuse of an infected person.
Okay. All right. So why do you think there are lower risks of children acquiring HIV in developing countries?
I would say education of the parents, of especially moms who have lived with HIV/AIDS. They're having C-sections instead of having natural childbirths, not passing it through the birth canal. Also, they're not breastfeeding. Also, with young teens, there's sexual education, practicing safe sex, learning about drug use, learning about transmission of not just HIV and AIDS, but other diseases also.
Okay. All right. Interesting. So what is the difference between children living with HIV and without it?
Children living with HIV, their immune system is compromised, so they're not able to fight off infection like any healthy, normal child would. So the common cold does not become the common cold to them. It becomes something 10 times worse. A UTI may spread to the kidneys faster than a child who has a healthy immune system. It attacks the T cells, the B cells, which we have to fight off infection.
Okay. So what medications are used to treat this HIV disease, if I may ask?
There's a combination of medications, which are the antiretroviral regimen or therapy, and these are used to support immune function by lowering how much HIV or AIDS there is in the blood, which is called the viral load. They increase the number of cells fighting infection in the body, such as T cells. They also help improve the quality of life by help fighting the infections of a secondary disease caused from their low immune system.
Okay. All right. So what can we do to help other countries reduce this risk of children living with HIV?
I would think education, teaching them, having knowledge about what the disease is, how it's transmitted, who can get it, who can't get it, which would be anyone's at risk of getting this. Also, to funding and the amount of healthcare workers probably that they have to kind of help spread the knowledge.
Okay. All right. I just want to take this time to say thank you very much for helping me.